Herpes vagina. Genital herpes is a sexually transmitted infection, STI, that results from the herpes simplex virus, HSV. It's most commonly transmitted through sexual contact, whether oral, anal, or genital sex. Genital herpes is usually caused by the HSV-2 strain of herpes. The first herpes outbreak may not happen for years after transmission. But you're not alone. About 1 in 6 U.S. people have experienced a herpes infection. Around 776,000 new cases of HSV-2 are reported every year. There's plenty that can be done to treat the symptoms and manage outbreaks so that your life isn't ever disrupted by it. Both HSV-1 and HSV-2 can cause oral and genital herpes, but we'll be focusing mainly on genital HSV-2. Symptoms. Early symptoms tend to happen around 2 to 12 days after infection. There are two phases: latent and prodrome. Latent phase, infection has occurred but there are no symptoms. Prodrome, outbreak, phase, at first. The symptoms of a genital herpes outbreak are typically mild. As the outbreak progresses, the symptoms become more severe. The sores will typically heal within 3 to 7 days. What to expect? You may feel a light itchiness or tingling around your genitals or notice some tiny, firm red or white bumps that are uneven or jagged in shape. These bumps may also be itchy or painful. If you scratch them, they can open up and ooze white, cloudy fluid. This can leave painful ulcers behind that can be irritated by clothing or other materials then come into contact with your skin. These blisters can show up anywhere around the genitals and the surrounding areas, including the vulva, vaginal opening, cervix, butt, upper thighs, anus, urethra. First outbreak. The first outbreak may also come along with symptoms that are like those of the flu virus, including headaches, feeling exhausted, body aches, chills, fever, lymph node swelling around the groin, arms, or throat. The first outbreak is usually the most severe. Blisters may be extremely itchy or painful, and sores may appear in many areas around the genitals. But every outbreak after that is typically less severe. The pain or itchiness won't be as intense, the sores won't take quite as long to heal, and you probably won't experience the same flu-like symptoms that happened during the first outbreak. How it's transmitted. Genital herpes is spread through unprotected oral, anal, or genital sex with someone who's infected. It's most commonly transmitted when a person has sex with someone with an active outbreak consisting of open, oozing sores. Once the virus has made contact, it spreads in the body through mucous membranes. These are thin layers of tissue found around openings in the body like your nose, mouth, and genitals. Then, the virus invades the cells in your body with the DNA or RNA material that makes them up. This allows them to essentially become a part of your cell and replicate themselves whenever your cells do. Diagnosis. Here are a few ways a doctor may diagnose genital herpes. Physical examination. A doctor will look at any physical symptoms and check your overall health for any other signs of genital herpes, such as lymph node swelling or a fever. Blood test. A sample of blood is taken and sent to a laboratory for testing. This test can show the levels of antibodies in your bloodstream for fighting off an HSV infection. These levels are higher when you've had a herpes infection or if you're experiencing an outbreak. Virus culture. A small sample is taken from the fluid oozing from a sore, or from the area that's infected if there isn't an open sore. They'll send the sample to a laboratory to be analyzed for the presence of HSV-2 viral material to confirm a diagnosis. Polymerase chain reaction, PCR, test. First, a blood sample or tissue sample is taken from an open sore. Then, a PCR test is done at a laboratory with DNA from your sample to check for the presence of viral material in your blood. This is known as the viral load. This test can confirm an HSV diagnosis and tell the difference between HSV-1 and HSV-2. Treatment: genital herpes can't be completely cured. But there are plenty of treatments for the symptoms of an outbreak and to help keep outbreaks from happening or at least to reduce how many you have throughout your life. Antiviral medications are the most common form of treatment for genital herpes infections. Antiviral treatments can stop the virus from multiplying inside your body, lowering the chances that the infection will spread and cause an outbreak. They can also help prevent transmitting the virus to anyone you have sex with. Some common antiviral treatments for genital herpes include valacyclovir, Valtrex, famciclovir, Famvir, acyclovir, Zovirax. Your doctor may only recommend antiviral treatments if you start to see symptoms of an outbreak, but you may need to take daily antiviral medication if you have outbreaks often, especially if they're severe. Your doctor may recommend pain medications like ibuprofen, Advil, to help reduce any pain or discomfort you have before and during an outbreak. You can also put an ice pack wrapped in a clean towel on your genitals to reduce inflammation during an outbreak. Herpes vaginal lips, herpes vagina, herpes vaginal, herpes vaginale, herpes vaginalis, herpes vaginal area, herpes vaginal odor, herpes vaginal pain, herpes vaginal rash, herpes vaginal swab. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.